Mila.
Hi.
You say hi to everybody.
Hi, guys.
What show are we on?
Mila Talk.
Mila Talk. How do you like staying home with mommy?
I love staying home.
You do. But do you miss school?
Just a little bit.
Just a little bit. Do you miss talking to all your friends and your teacher?
Yeah.
Yes, and using your brave voice? I think so too. But we're still practicing. Are we still practicing your brave voice?
Yeah.
Yes, and you're doing such a great job. Yeah? Okay. Well, what do you want to say to everybody?
Thank you for watching Mila Talk.
Bye-bye.
Bye.
I want to first give a shout out to Stacker Millie for commenting on our videos that this is great content and Mila has such a brave voice. We would love to hear your comments. Please comment below and let us know what type of contents you would like to hear from us. Also, let us know your child's name because Mila would love to give a shout out to your child, provide them with motivational encouragement and brave talking. We appreciate everyone joining our journey, and we hope that what we provide you is educational and will give you a glimpse into what we went through in order to get Mila talking within 256 days of being nonverbal. If you have not subscribed yet to Mila Talk, please do so. Subscribe below and join our journey. In today's video, we wanted to share how to navigate the healthcare system. Healthcare is a very complex industry with many rules and regulations. With over 20 years of hospital operations and now recently health plan, I want to help you understand the healthcare language as well so that you have the tools in order to find the right plan that will meet your family's needs. Depending on what health plan you choose, it's critical to understand your benefits. I will be discussing the 4 main health plan products today, excluding government, Medicare and Medicaid, and VA. When it comes to health plan products, there are 4 basic products out there. I'm going to list them from the most restricted to the ones that provide you with the most access to providers. In an HMO product, there's a lot of restriction there. You have to have a PCP, a primary care physician. You also have to have a referral in order to see a specialist that's within the network. And normally in an HMO product, the plan will not reimburse you if you seek services outside of the network. In a POS, or point of service product plan, you also require a primary care physician and a referral, but most of the time, the insurance company will actually pay for you to seek outside of the network as long as you have a referral by your PCP. In an EPO, or exclusive provider organization network, you're not required to have a primary care physician, nor are you required to have a referral to see a specialist. The only thing you're required to do is see physicians that are within and contracted within that network. The plan will not cover any services outside of the network. And in a PPO product, the Preferred Provider Organization Network, it consists of providers that are contracted with your plan. You are not required to have a primary care physician or obtain a referral to see any specialists within that network. You can also see outside the network, but the cost to you will be a little bit more out of pocket. Some basic terminology when it comes to health plan is what's a premium. A premium is an amount that you pay on a monthly or it could be a quarterly basis depending on your contract with the health plan. And that's to ensure that you are a member of the plan and you have health plan coverage. A copay is a fixed amount that varies depending on what type of services you seek, and it also varies by the health plan and product that you choose. A deductible is the amount of money you need to pay out of pocket in order for your insurance to start kicking in and start paying at the contractual amount that you chose as a benefit. Coinsurance is a percentage of cost that you share with a health plan, and that's a portion that you will pay in addition to any of the deductibles that you have not met yet. Out-of-pocket limit is the maximum amount of money you will pay into your healthcare services. And once you meet the out-of-pocket amount and limit, that's when your health plan will kick in at 100% and pay for your services that you seek for. Now, there's out-of-pocket for an individual, yourself, and if you have dependents under you and your health plan, then there's also an out-of-pocket for a family. Regardless of which health plan you have, every single one of them either has a copay, a deductible, or a coinsurance that you would have to pay out of pocket. PPO plans have higher premiums, deductibles, and out-of-pocket expenses than any of the other plans. And that's because you have more freedom to choose and refer yourself to a specialist. With the PPO and POS product, the physician has the right to balance bill you for any of the differences that your insurance did not pay. You want to make sure that you understand all of the costs that you will be sharing with the health plan. So in this example that I'm showing you here, the differences between a deductible, a coinsurance, and out-of-pocket expense, we have Jill who has not met her deductible of $1,000 yet. And because she has not met her deductible yet, her plan does not pay any of the costs. She will have to pay the allowable amount until she hits that $1,000 deductible. And in the second example, Jill has now met her deductible. And so then her insurance is kicking in at their co-insurance rate. Most co-insurance differ as well and varies between the plan that you choose. It could be 20%, it could be 15%. There are 10% out there. So you need to determine what is your percentage and what can you afford when you choose a plan. So in Jill's case, because she has met her deductible, now she is responsible for only 20% of the allowable amount that they're contracted with. And now the insurance is paying in at 80%. In the third example, Jill has met her individual out-of-pocket maximum expense for the annual year or the period of the insurance, which is normally an annual period. And because of that, the health plan kicks in at 100% and pays for the total cost of the allowable amount. When selecting a health plan, determine the following. What are my needs for the future or for this year? If you have a child with selective mutism, we know that we will be seeking a lot of therapy services, whether that's individualized or group therapy. Make sure they're all covered. Parent group therapy as well. In addition to that, think about all the annual appointments that your child will need and including yourself in those calculations. Determine what is it that will help me the most. Financially, what can I afford in order to help take care of my family? It's very important to understand the benefits of your product plan in order to pick the right one for you and your family. Because Mila has selective mutism, the first thing I wanted to make sure I looked at was the mental health benefits. Do you need a referral from a PCP or pediatrician? Do you need an authorization in order to see this therapist or this provider that can help treat your child? Understand the maximum amount of visits you can have per year, or is it unlimited? In the past, the health plan insurance had a cap on how many visits per year you can seek for mental health benefits. Time has changed within the health plan industry, and the priority regarding mental health benefits is huge now, especially in children. Therefore, most health plans have eliminated the maximum cap on visits per year. Most of them don't require authorizations and referrals anymore either. So it's really important for you to look at your benefits because, again, every single one is different. So how do I get my out-of-network provider at network? There are two categories when we talk about out-of-pocket expense. There's an in-network out-of-pocket expense, and there is an out-of-network out-of-pocket expense. Your out-of-pocket for out-of-network is a lot higher than it is for in-network. Therefore, it's really important that you seek services with providers within your network. The sooner you hit your out-of-pocket expenses, your deductible, your coinsurance, that's when your insurance will kick in at 100%. But what if your provider's out of network? How do I get my out-of-network provider in network in order to capitalize and maximize on my in-network out-of-pocket expense? And being in the health plan industry, there are a couple ways you can do this. The health plans call this a single case agreement, and providers normally call this a letter of agreement. They are both exactly the same thing. They're interchangeable. But for now, I will use the terminology that the health plans use, which is a single case agreement or a SCA. Every single health plan can contract with a provider through a SCA for a specific case or a single case, which is why it's called a single case agreement. Health plans normally do this if you can't find an in-network provider for your diagnosis within a 30-mile radius. However, you as a member can't reach out to the health plan and request for a single case agreement because you are not a clinician to provide a diagnosis. It has to come from a provider calling the health plan insurance company and asking them to create a single case agreement. And they need to provide a diagnosis. Make sure that the diagnosis is selective mutism. If you provide any other type of diagnosis like general anxiety or social anxiety, most of the time that will be rejected or denied because it's too general. So in our case, make sure your physician, your provider, calls the insurance company and provide the diagnosis of selective mutism. There are two scenarios when it comes to a single case agreement. The first one is if your provider will bill the insurance company. If they are willing to bill the insurance company, then request your provider to call your insurance company and ask for a single case agreement for your case alone. Now, health plans and providers normally negotiate on a rate when it comes to a single case agreement. They don't have to agree on any rate, which means there will not be an agreement in place. Or in certain situations, they can agree on a rate that the provider is willing to accept for just the single case alone. In that situation, the provider will bill the insurance directly and just receive payment from the contractual rate. The cost that you paid to see the provider will now be moved from your out-of-network, out-of-pocket into your in-network, out-of-pocket, therefore reaching your maximum limit faster. So the second scenario is, what if my provider doesn't bill the insurance? What can I do in order to move my provider from out-of-network to in-network? The process is exactly the same as above. You want to ask them to request for a single case agreement between you, the member, and the health plan. Once you have a single case agreement between you and the health plan, when you do pay the provider, take the invoice and the receipt and submit it and file a claim with your insurance. And that's when they will move those dollars from your out-of-network to your in-network, out-of-pocket expense as well. In our situation, Mila's therapist is out-of-network. While we were waiting to resume therapy with her, I really wanted to get a definitive diagnosis for Mila. And when I reached out to Kurt Psychology, I started the consultation immediately. They are also out-of-network. Because there wasn't a therapist within 70 miles that treated children with selective mutism, I was able to have Kurt Psychology call my insurance plan and create the single case agreement in order for me to move those dollars from out-of-network to in-network. Most single case agreements are normally 6 months to a year, so it's really important to know that at the end of the term, you will have to renegotiate again and have a new contract in place, as long as you need to seek services and therapy for your child with selective mutism. Are there other options in healthcare that will help benefit me and my child as we go through this treatment for selective mutism? There are a few other options out there that many people aren't aware of. Number one is if you have an employer that offers EAP, Employee Assistance Program, then you need to utilize those services first. With an EAP program, there are normally 5 sessions that are offered free per diagnosis and per person that are covered by your benefits, whether that's you or your dependent, your child, your spouse. And that's per person, per diagnosis. This is a great opportunity for you to utilize those 5 free services when you're out there searching for the right therapist for you and your child. I definitely utilized that with my organization, and through 3 different therapists and sessions is when I was able to find the right fit for us. If you have not seen our video regarding how to find the right therapist, right here, click on the link below, watch it. It gives you the 7 key questions on how to find the right therapist that's the right fit for you and your child. But using the EAP program really helped us. I was able to use it for myself when I met with a therapist individually, and then I was able to use it with Mila when she met with the therapist to make sure that they were a right fit as well. Another option is called MD Save. You can find that at mdsave.com. MDSave is a website where a lot of providers contract with them at a discounted rate to provide services for cash payers. Many of us have insurance, but we also have very high deductibles. Therefore, if you have the ability to pay out of pocket with cash, the MDSave is a great way to go because it's truly at a discounted rate. Sometimes you can find rates in there for about 60% less than what's being offered or what the insurance has contracted with the provider. Most of outpatient services are provided in MDSave. So check to see if your provider is contracted or listed in MDSave to see if you can get a discount that way. And the third option is that you can negotiate with your provider at any amount. Not many people know that most providers will offer a discount if you ask, especially if you're a cash paying patient. It will be discounted. Maybe it's 10%, maybe it's 20%. They also provide a payment plan. So if you can't pay your full amount at a certain time, then put in place a payment plan so you can continue to seek services with that provider and help your child. In the next video is the most anticipated video that many parents I see ask for all the time, and that's how do I get my 504 and or IEP plan approved? We will share with you what we went through and our process in order to get ready for our first meeting regarding 504 and IEP. And we'll share with you how we got it approved during that meeting. We have many more topics coming up, but we also want to make sure that we provide the right contents for you as well. Please comment below. We would love to hear what you have to say or any other contents that you would like us to share. Thank you for joining us, and we'll see you next time.